My name's Gerry Sweeny. I'm a 63-year-old man. I have a nursing background, nursed for 32 years. I have a daughter who has Addison's disease.
Take your time, it's okay.
I think I'm in the wrong place. For what I have listened to from the board today, it seems like everything's hunky-dory. And that is certainly not our experience in A&E. It seems everything is 99.9%. And you only have to tweak 1%, or give us a few more £1 million and we'll get a few more staff and everything will be all right. In my experience, any time I have been in A&E, I have seen any God's amount of staff colloquial at desks and not with patients. Because I'm a nurse, I pick it all up. My daughter, 2 weeks ago today, she went in out of hours practice. She had a head cold. The doctor told her not to double her cortisone. Now, anybody that has any idea of Addison's at all knows that whenever you get a cold of any description, you double your cortisone. Because her cortisol levels do not rise and fall with infections, she must take extra steroids whenever she has any sort of infections. If Amanda had heeded that advice, she would be dead, because it's been given to her on numerous occasions. She doubled the cortisone. She was still unwell. She was trying to get an antibiotic. To get an antibiotic in the surgery that we are, you would have to be dead. She went in again to the surgery on Sunday night. She seen another doctor. The doctor did give her an amoxicillin. It done very little good. She went back to that surgery on Monday again. The doctor said she would have to go to accident emergency. She went to accident emergency. She called an ambulance. Ambulance was an hour and a half. I had to eventually take my own daughter to accident emergency. This is a serious, life-threatening illness. And there are serious Addisonian crises that occur with it. You go into accident and emergency. She went to AMU. She was sent to AMU. The doctor gave her one injection of cortisone into the vein and sent her home. It is totally unacceptable. You can't say anything.
This is out in the Galvin.
This is out in the Galvin we're talking about.
Okay.
You can't say anything to a doctor. You can't voice them any word of concern at all. They won't listen to my daughter. They won't listen to me. The doctor knows best. There is no consultation. As the doctor says, I'm going to do, and that's that. If you don't like it, you can leave. Basically, that's what they say. She was discharged. There was a great hurrah on, I think there was part of it in television, about that Monday, about Alton Galvin getting admissions and discharges within 4 hours. Mm-hmm. That's why she was discharged, in my opinion. On Wednesday, she's still been feeling unwell. I have had to give her own injections throughout the week because she's not getting the steroids she needs. Because she's not getting enough steroids, when she's admitted to Alton Galvin Area Hospital, then she's getting too many steroids. If anybody can understand that, she should be getting, whenever she goes in an Addisonian crisis, she should be getting at least 48 hours steroids into the vein. She would be all right after that. But because that is not happening, it's not accepted that it's an Addisonian crisis. They won't give the steroids. Then she's getting too many because I'm giving her steroids. She was admitted to hospital again on Thursday. A doctor says to her, "Oh God, Amanda, you're very tan. Were you in the sunbeds?" For an Addisonian patient with pigmented skin. There was no consultation. They came down and he started to give her IV. There was nothing from the nurses. There is no reassurance. I have great sympathy for nurses, but not when my daughter's at risk. There was no reassurance. I tried to speak to the doctor. An argument ensued. He wouldn't accept that it was a crisis. They said her blood pressure's all right, her bloods are all right, her Addison's is stable. I says, it's not stable, doctor. You're ignoring all the other signs and symptoms that she has. You're ignoring the spinning head. You're ignoring the severe back pain. You're ignoring the any other sign, the stomach cramps that she has, what's causing them, I don't know. It's viral. It's viral. It's viral. Anybody that knows it, very few. Amanda has Addison. She's been treated by Londonderry Hospital for about the last 6-7 years. So it's 2005. Amanda's had 9 years. When the Addison's treatment is ABC, it's not rocket science, but they won't listen to the patient. They won't listen to the family member. They just won't do it. There is no consultation. There is no care plan and consultation with the patient. The patient knows nothing. They all know about Addison's, but nobody knows how the disease works. It's as simple as that, and they don't take on the individuality of the disease. On Friday last, my daughter was discharged. I have the thing here. I have the discharge letter here, and it's on it. On the 19th. There's no secondary diagnosis on it. It's just pernicious anemia. Relevant investigations, 0. Information given to. Put it down as viral infection. I had to take her to out of hours again on Sunday. And this time I decided she's terrified, and I mean absolutely terrified of going to A&E in Londonderry Hospital. I took her to Enniskillen Hospital. She went into AM1, as I think they called it, Enniskillen. Within 20 minutes, they diagnosed an Addisonian crisis. They were able to check her bloods. They said, your bloods is all right. Your blood pressure has come up now. It was low. But because of the rest of your symptoms, you are experiencing an Addisonian crisis. If I don't treat you, you're going to get worse. The thing about not getting enough steroids, she can collapse, her blood pressure crashes, and she dies. I'm trying to keep my daughter alive. They give her. What
treatment did she get then?
She got 200, not 100, 200 milligrams of steroids IV for 48 hours. That's a proper treatment for an Addisonian crisis. The doctor said there is no evidence of viral, there is no evidence of any other infection. Yet in Londonderry, they insist that it's viral. Now, there has to be something badly wrong there. Has to be something badly wrong. You know, they have down Addison's disease, B12 deficiency. She fought 4 long years to get B12. She has B12 antibodies for 4 years. She fought 4 long years to get B12 injections. Every test she has called, she had to research it herself on the internet. She had to ask for the test to be done. There was a great reluctance to get tests done. A great reluctance. But the tests were eventually done. Every one she called was right. Every one. I could see through it if my daughter was asking for tests and they were all wrong. But they're not. They're all right. Every call she has called since she's had Addison's has been correct. I'd be wanting to learn from that girl if I was in an accident emergency, if I was a nurse. I'd be wanting to learn from her. Just to here's something here. 29th of December, she was admitted, vomiting and retching, she was admitted. A nurse came along with 30 milligrams of cortisone and insisted she take it orally. She says, nurse, I can't keep it down. She says, you're going to have to try. She says, nurse, I'm not able. She says, you're going to try and keep it down. She literally forced her to take 30 milligrams of Addison's. But my daughter vomited up on the floor, and the nurse says, GAC, she says, you just can't vomit up where you want to. The doctor, a consultant, whom I could name, but I'm not naming, came round, and he ordered IV 100 milligrams stat. Now, stat means immediately. The nurse said, oh, no, you can overdose on cortisone. She says, you're overdosing too much cortisone. You can't not overdose on cortisone. It's impossible. That injection was withheld for 8 hours. 8 hours, 8 long hours. My daughter could have died. There was an adverse clinical incident, or whatever you call it, completed. Now, Amanda asked for it, and it wasn't forthcoming. That's vomiting. That's one admission of vomiting. The 28th of October, she was vomiting. She was admitted. The 20th of March, she was vomiting. She was admitted. The 23rd of June, she was vomiting. She was admitted. The 4th of July, she was vomiting. She was admitted. Now, I put it to anyone in this room, if they were admitted, that 1, 2, 3, 4, 5 times vomiting, would they expect an investigation into why they were vomiting? That is just not acceptable. It's just not acceptable.
Okay, can I ask you a couple of questions?
Well, I need to say a few more things about that.
Yeah, well, let me ask you this, and I will be more than happy to let you finish them. What I was interested in is, even from what I've heard, clearly in terms of Galvin, your daughter is there on a regular basis and is clearly with Addison's and clearly often presenting with the same symptoms. Do you have any sense in which they know already? You presumably are seeing some of the same people more than once. You're not seeing a different. Are you seeing a different doctor every time you're there? Are you seeing the same clinicians? Are you?
Well, this is it. You rarely see the same people, but if you do, it doesn't make any difference.
Sure. And do you have any sense in which, for example, if your daughter arrives, that they, in a sense, already know her medical history because she's been many times before? Or do you feel it's starting almost like from the beginning again to have to explain her situation?
Everybody takes a new history. The ambulance is called, they take a history.
Yeah, okay.
You go into A&E, they take another history. You're admitted to AMU, they take another history. Now, that has to be wrong. There's something wrong about that.
Sure. Okay.
Anyway, at 5 times she was admitted with vomiting. Nobody investigated why she was vomiting. I said to Amanda, not so very long ago, about a month, 6 weeks ago, I says, Amanda, are they not going to investigate the vomiting? And say, you'll have to go to the GP and ask. She says, Daddy, they'll not do it. I says, well, go to the GP and ask for a Helicobacter test. She went to the GP and asked for a Helicobacter test. And the GP says to her, you have no symptoms. She says, Doctor, I've been admitted 5 times with vomiting. I says, that's to do with your Addison's. Yet, Anthony Galvin says, that's viral. And he was very reluctant. She begged him to do the Helicobacter test. It was positive. There was an infection in her gut that wasn't being treated. It proves it. If she had it treated after the first vomiting or second vomiting, she wouldn't have had all the other admissions. Mm-hmm. They're working against themselves. They're trying to save money, but they're spending pennies to save pounds. Spending pounds to save pennies, rather.
Yeah.
I mean, one other occasion, I can remember lots of occasions that she's been admitted because they're ingrained into my head. One occasion she was admitted, and there was a male nurse outside the cubicle with 2 other female nurses. And the male nurse could be heard joking and laughing with those 2 other nurses. Ha, 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 Adidas disease. Now, I made a complaint about that, and I made a complaint to my 4-year-old grandson. I'd come back with a statement on it from the accident and emergency sister to say that there is no way that her staff would be involved in any such practice. I have stopped making complaints because they just fall on deaf ears. All you ever get back from Altony Galvin Complaints Department is, we are sorry that you found the service unsuitable. We are sorry that you found the service unsatisfactory. Actually, it says that she reads all the complaints letters. I wrote to you not too long ago. I got 0 in return.
Okay.
I've written to her recently, within the last week again, asking for the name. Whenever my daughter was admitted recently, and on the Thursday night, here this is completely, and I mean, this is not, I can prove all the stuff I'm saying. I can prove it all. Every last thing of it I can prove. On Thursday, my daughter, when she was admitted, the next morning, Friday, there was another lady admitted to the same cubicle who had diabetes, serious diabetes. There was a lady consultant came down to that woman and was shouting at her. Because the woman had taken a lot of hypers, and apparently in hypers, I don't know much about it, but apparently in hypers you need insulin to get down. I don't know if that's 100% or not. But because she was experiencing a lot of hypers, it was plain to hear. You could hear this ringing out on the 4-bedded cubicle. Because she'd taken a lot of hypers, she gave herself extra insulin. The consultant came in and shouted at her twice. In my opinion, it was shouting. You could say talking loudly, but if the consultant was talking to me the way that she was talking to that patient, I would say she was shouting at me. She says, "You tried to kill yourself." The patient said, "No way, I did not try to kill myself." She said, "Yes, you tried to kill yourself." Now, I do not think that that's acceptable in any standard of life. On the Thursday night, prior to that, I went in to visit my daughter. My daughter is sweating profusely, and I mean sweating profusely. It's part of the crisis. You look at anywhere in the symptoms of a crisis. If you look anywhere in the symptoms of a crisis, you will see it sweating profusely as one of them. I says, "Amanda, you're very warm." She says, "Daddy, I don't know what it is." She says, "I think my temperature's up." I says, "That's all right. I'll ask a nurse to take your temperature, you know." There was a wee nurse over at another bed. I says, "Nurse, excuse me." I says, "When you're finished, could I have a word with you?" She says, "I no bother." So she come over, she had a word with me. And I says, "Amanda's very warm. Is there any chance of getting her temperature taken?" I says, "Is that an air conditioning unit above you? Can I get it switched on a while?" "No, we can't switch that on because it has to go on all over the hospital." And I explained the whole situation to her. She says, "That's grand." Amanda says, "I have back pain, any chance of getting a couple of Panadol?" She come back with a Panadol. 10 minutes later, the ward sister came down and she accused us of leaving the nurse in tears. I says, "I left nobody in tears." And that nurse, that sister, continued to argue with us in front of other patients. I actually asked the woman in the other bed, I says, "Did I say anything to leave that girl in tears?" She says, "I didn't hear anything that you would have said would have left her in tears." And that sister allowed herself to get into an argument with me and my daughter, leaving my daughter seriously distressed, crying, retching, to the point where she had to get Valium to calm her down. Now, Amanda, then, whenever she had calmed down, asked for that sister's name. She asked for the other nurse's name. It wasn't forthcoming. The nurses will not give their names. They're wearing name badges. They're either turned in or they haven't them on, or they won't give them. She asked for the name of the nurses in that serious incident where the cortisone was withheld for eight hours. They wouldn't give them. The trust won't give them.
Sure. Gerry, can I come and ask a couple of questions of you? I suppose the first, clearly you've been left very unhappy with the service you've had at Out the Gelvin, and interestingly, on the one experience, if I'm picking up right, that in Enniskillen, you actually got the treatment that you felt your daughter needed. In terms of changing that experience in Out the Gelvin, what are the issues? I mean, I think I can pick out some of them, but it's helpful if you tell me what would change the experience for you. What's needed? You know, what is it that you need? If you had to go to Out the Gelvin again tomorrow with your daughter, what are the things that the trust would have to do in the emergency department to actually make the experience in Out the Gelvin as effective, for example, as that one experience you had in Enniskillen? What are the things that you would expect that would make a difference to? If
my daughter's admitted in a crisis and she believes she's in a crisis, we have a letter here from our consultant.
Yeah, no, just take me through what it is. Yes, what it is you want.
She needs to get cortisone first. Triage all you like afterward. Okay. She needs to get cortisone first, IV. I have on many occasions have to bring her pack with her, and the nurses will stall and stall and stall. On one occasion, there was 4 nurses around her. She's retching her guts up, and that's the only way I don't have all the fancy platitudes that other people have. She's retching her guts up. From she has got into the ambulance at Sion Mills till she's landed in A&E. No, the ambulance staff haven't given her anything.
If I'm picking you up right, and tell me if I'm wrong, when it sounds to me actually that what you're saying is the first thing you need to happen is for you and your daughter to be listened to. I mean, is that a fair
That's it.
summary?
That's exactly it. We are not listened to. Okay. There is no planned consultation with the patient. There is no planned consultation with the patient. Nobody sees Amanda and says, "Amanda, what would you like?"
Okay.
Yeah. Now, I can give loads, and I'll tell you one other night we were at Mediterranean. Well, it was early in the morning actually. and 2 nurses. One of them who wouldn't give her name either. Another nurse who wouldn't call the doctor. Actually, the doctor was walking past and came in and gave him under the treatment she should have got. He ordered, I'm cutting it all down, he ordered an ECG. He put the sticky parts on her for to get an ECG. That nurse came in and pulled them sticky pads off her and told her she needed no ECG. Now, I would like to ask that nurse, how did she think that made the patient feel? She was transferred then to A. I had to give that injection myself, because they were prior to the doctor coming in. I had to give an injection myself. Okay. She needs the injection. The thing is this, regardless of what they triage with Addison's people, regardless of what you triage, they're going to end up needing cortisone anyway. I have it, and I would like to read this out of it's the British Medical Journal. It's not me that's saying it. It's the British Medical Journal. And I'm going to only read bits of it. Last but not least, listening to a well-informed patient in adrenal crisis who says that he or she needs steroids and taking urgent action will avoid unnecessary deaths. And this is an eminently treatable medical problem. I mean, that there says it all in one small statement.
Yeah. I think, can I ask you one other question, and I'll open it up to my colleagues. You've said you've been through the complaints procedure. And
yes.
Again, if I picked you up right, you're saying that essentially because of how your complaint has been treated, you've lost faith essentially in continuing to complain, or you're still writing but you haven't got a great deal of faith. In terms again of the complaints procedure, what is it you want as an outcome, and what again would make it different in terms of your needs when you want to give feedback to the trust?
Very, very easily. It's very, very simple.
Sure.
I certainly don't want it written, "We are sorry that you experienced."
No.
I think that is just a blame the patient apology, and it's simply not acceptable, and that's why I stopped writing complaints. I didn't stop writing complaints. What I put in the complaint now, you can phone me if you wish. Nobody phones. Last January, last February was it, I applied for my medical notes out of Londonderry Area Hospital. When I got out my notes, there were 70 pages of another man's notes and among mine, mixed up with them. And 4 pages of another man's notes mixed up with them as well. Now, I arranged to hand them back to a man in Londonderry Hospital, and he says, "Come down, you and me'll have a chat and I'll hand him the notes." He says, I said, "That's grand, no bother." When I come down, there was 4 people waiting on me in one room. He didn't give me any opportunity to bring anybody with me. And I says, "Well, I can't do this under this terms." I says, "I need to bring somebody with me." I walked out down the corridor and I was harassed by that man who wanted to put me in an office. And he put his arm in front of me several times. That's not acceptable from anybody within the trust. I tried to arrange it again, and then I was accused. But they're very quick. What's happening? They're very quick to ring up when they wanted the notes back. Another woman rang me who was involved in passing out these notes. She said, after a lot of discussion, she agreed that somebody would come to my house, go through it. And I said, "That's okay." I says, "But what I tried to use the notes as leverage to get some discussion on my daughter's account."
I'm going to ask my colleagues if they have any questions. Marion?
I have only one question, Gerry, and it's born out of ignorance. So if I don't know anything about Addison, so what I'm going to ask may not make sense, so just tell me it's not right. But I'm just wondering is there any way, given that your daughter has these Addisonian crises, that community medicine, with your input, could help support her to be at home rather than go to hospital?
There is, that could help, but we have the self-injections. We have the injections to give in an emergency. Mm-hmm. But the difficulty with that, if the ambulance people come and I have given the injection, it temporarily brings up her blood pressure. Mm. So they test her blood pressure, blood pressure scran, At one stage, when she was taken in by ambulance, they put up on the screen, or Amanda's seen it, I seen it up on the screen, vomiting out of her yard. Mm-hmm. That's what we seen on the screen in ambulance. We didn't say anything about Addison's. Now, they claimed later that Addison's was on the screen. Now, the only man that I have got any solace from in Londonderry Hospital is a guy in the ambulance called. The ambulance staff, some of them will come out. If I don't get there in time and they get there before me, the other calls, they're supposed to give the cortisone, IV, but they won't give it. Some of them will. If I have given it, they'll tell you, oh, if we'd have been here first, we'd have given it. If I'm not there first, they'll say, oh, no, we can't give it.
Right.
There's the difficulty. And whenever she goes into Londonderry Hospital, because her blood pressure is still relatively normal, on one occasion, it's back a number of years ago now, I begged a doctor in accident and emergency to give her a shot of cortisone. I begged him at least 5 times. I begged the nurses that came in after him at least 5, 6, 7 times, going, please get it. I says, my daughter's blood pressure is going to crash. The alarm kept going off on the blood pressure machine. And the doctor kept coming in and switching it off. And every time he came in, I asked him to give cortisone. And eventually he lost his temper and he shouted at me, I know the treatment for Addison's disease. Her blood pressure crashed. She had to get cortisone. It's all down somewhere. She had to get cortisone 400 milligrams every 6 hourly for something like 48 hours. That could all have been avoided by simply giving her a shot of cortisone IV and casualty.
But what I'm wondering is there any... Now, this is born completely out of ignorance.
I'm quite willing to educate you.
But I'm just wondering, is there any reason why, when you know that, and the doctors know that there's 48 hours of intravenous steroid needed, is there any reason why that can't be administered in the community? Through the community nursing services?
You would need supervision. She needs to be in hospital to be supervised.
Right, okay.
Because she may need other things
within the community.
As well as IV, she'll need fluids. Right. She'll almost certainly need fluids, which are not always given either. Right. Once they test the bloods come back normal. That's it. They wipe her off everything and out and send her home. Basically, that's what we get.
Right. Okay.
Basically, that's what we get. They ignore the spinning head. They ignore the back pain, which is called flank pain. It's all related to our Addison's. If you want to be educated, you need to talk to Amanda. Amanda calls everything right. She's looking for a test on now, which they're not doing, as her thyroid T3. They won't do it. It's a simple test. Why will they not do it? They won't give her the loading dose. The GP's practice wouldn't give her the loading doses for B12. They would not give her the loading doses. But you're saying about a plan there in the community. There's a very easy plan, and I tried to get it the time that I put on an appointment. That's what I wanted. I says, if they don't want to record it, then let's talk about the Addisons and get a plan put into place where my daughter goes into A&E, that somebody looks at the plan and say, this is approved by A&E department, it's approved by her consultant, it's approved by everybody. I says, if we can't get 100%, let's get 80% agreement. That's not rocket science. That will alleviate everything for my daughter. But all the nurses, the doctors will say it too, we know what Addison says. There was not too long ago, she was admitted to A&E. I can recite this chapter and verse because it's ingrained into my brain. She was wearing a heavy hoodie sports top. You know what that is? Right? A nurse come in, she had it pulled up there. A nurse came in and took the blood pressure over the top of that hoodie. First time. Now that agreed with what the nurse wanted the blood pressure to be. So away she went. She came in half an hour later or an hour later, I'm not sure which, but anyway. She put it over, a different nurse, put it over the top of the hoodie again and took it. And because it was 80/40, she blamed my daughter for not having her hoodie off. She then, I'm in the cubicle at this stage. She then demanded my daughter take her hoodie off, and she has only her bra for cover. And because then there's a bit of Amanda says you're ignoring the fact that I had Addison's. She says I didn't know you had Addison's, and then later she claimed she didn't know she had Addison's. Then at that stage she walked out of the cubicle and she got the charged person. The charged person came in, who was a man, And he then told the other nurse to go out. My daughter then, blood pressure was taken by a charge nurse. There was 2 males in that cubicle. My daughter had only her bra for cover, and nobody seen that there was anything wrong with it.
Thank you very much. Thank you.
Okay.
Paul?
Thanks, Gerry. Just one short question. Sometimes there are patients groups or civil society organisations organised around particular medical conditions to raise awareness of the particular distinctive issues arising from that medical condition. Like Marion, excuse my ignorance, is there such a civil society organisation for Addison's patients?
There's an Addison support group, and every doctor you ever talk to will tell you they're crowding others. That's how the BMJ has taken that from the support group. Are you want to do?
Yeah, I'll take it, because I think the quote you gave us earlier from this was really useful.
The BMJ adopted a lot of that, how to avoid precipitating an acute adrenal crisis.
Okay, thank you very much.
Most of the doctors, just on that point, most of the doctors don't know the difference between Addison's disease and acute adrenal crisis.
Okay.
Thank you.
Jay, that's really, really powerful testimony. Thank you. And I think you've covered that very eloquently, and I know how difficult it's been. I have to say, and we've said this to all the patients and family members of patients, I know how difficult it is to give evidence, but this is crucial to our inquiry. It's a really important part of the inquiry to hear at first hand from people who've had experience in emergency departments. And just want to, in the same way as we've offered to everyone else, is there anything finally you want to say before we then bring the next witness to the table?
I do not believe that anything will change, because I do not believe that the Trust will take on its consultants. I do not believe that the Trust will make any changes because they're doctors. I just don't believe that anything will change. And I believe you're still beating your head against a stone wall with regards to viruses and adrenal crisis. That's what I believe. That's what I firmly believe. And time will tell.
Okay. Thank you. Thank you very much for coming this afternoon.